The 13th floor. The 13th floor.
Welcome, ladies and gentlemen, to the 13th floor. What is always the best. We got bad camera angles and everything, but the views are amazing.
Yep.
I am your moderator, B. Jones, and I am joined by this bunch of knuckleheads here. We got Mike D jumping up and down like he about to set it out. What's happening, bruh?
From cell block 4.
Whoa.
I lost my number. I ain't got my number. Cross. OD.
There it is. J Days, what's happening, baby?
What up, man? What's
Where
going on?
my line at? I'm upset.
I'm in a different room this time, man. I'm in a different room.
Cool, bro. Don't disrespect the lion, man. Make sure he's in the backdrop at all times.
Gotcha.
There it is.
Face.
Jamie in the same room on opposite side.
So, look, you're looking a little bit cooler. What's happening, baby?
Oh man, just enjoying life. I'm out here in Dallas. Got an early flight. But before I get my thing in, I just want to throw a shout out to you, our resident, our producer, our know-it-all, our podcast moderator. We don't shout you out enough. You do amazing things, and I just want to pat you on the back from afar. So here you go. I'm going through the camera and patting you on the back right there for you.
I hate to see what it looks like when I actually get some time to be in this thing for real. I appreciate the love, man, at all times. I mean, you're a great group of guys. Y'all keep me lifted when I need to be lifted. So, we work together on that. Now, we got Coach K up there. T-shirt game strong. We'll have to get a vote in on this one. Coach K, show the T-shirt, bro. You said no?
Make a noise first.
Let us know you still with us.
You got to talk in order to be on the solo screen.
Money.
That's nice.
Fresh, work your magic, man. Get his T-shirt in there. We will make a vote. Who got the coolest T-shirt on the 13th floor? Faison with the I'm a little bit cooler, or I'm a little cooler.
I got the T-shirt. I can bring next week.
We talking about today, man. Stay ready, bro.
Contest will be over by then.
Coach K, how you feeling, man? You out there in Atlanta, right?
Yeah, I'm in Atlanta, man. Just on here looking at us looking like a bootleg Brady Bunch.
Hey.
2 kids, so we had to get rid of
Which ones we missing?
We put them up for adoption.
Who we missing? Anybody know?
We just missing BJ, right?
No, I'm talking about in the bottom of the boxes from the Brady Bunch. They was all in the same order every week.
Man, I
don't know. I ain't even watched that show.
Missing Cindy, and we missing what was his name? Bobby, maybe?
Yep, there you go. Ding, ding, ding.
Bam.
Dang, y'all some real TV sitcom experts.
Hey, it was only like 10 channels. Yeah.
Yeah, no choice.
Hey,
We turned off.
we didn't always have BET.
That's fair.
We did have Amen.
Oh, that was a joint.
Oh, easy. Last but not least, our rock, our staple, my brother from another. We in this thing strong, baby.
Represent.
What's up?
You know what it is. You already know what it is. I want to go ahead and give a shout out to Art's Beard, yo. Since we giving subliminal shots out and things that don't get represented often. One time for my dog's beard, man. I know the work it takes to get a beard, and I especially know the work that my man put in to get his beard. But one time for it, salute. We got some other scruffies out here. I don't know if we fully call yours a beard, Brett. Go ahead and, one time, let's keep this thing moving.
Hey, man, while we give shout outs, I mean, I think, I appreciated everything you had to say, Art, but I definitely think Fresh is most deserving of that, man. He is the glue that keeps this thing together, man, and he is the jack of all trades that keep this thing going, from the social media to the editing to the recording to the freshness and energy and excitement we have each and every week, man. So we appreciate you, sir.
Yes, it is.
Hey, man, I am the glue that binds, and that glue is Fresh. Let's go.
Let's go, man. We continuing with the wellness theme here on the 13th floor for this month. If you haven't had an opportunity already, go back and check us out on episode 70, where we talked a little bit about your diet and eating right, eating to live, and then get on episode 71, man. Probably the best podcast we've had to date. And I'm throwing you up there, Chris, because you know what I'm saying? You gotta step up to the plate now. But last week, man, living on the left side of the menu with our man Jamal King, he dropped a lot of lot of good information on real estate investment and a lot of good information on how to make your life just a little bit better and things you can do on that end. So definitely take the time, check us out on episode 71.
Hey, I'm sorry, man, but for the people that actually watch the podcast, they can see we have a guest. Like the people that just listen, they can't tell that there's a guest, but the people that watch can see. So you might as well introduce her. And I don't know what you're saving it for because people looking at her.
Thank you, Carol. Dang.
I'm trying to. That was my segue. So
I thought he was doing a good job.
I thought it was coming.
It was Hey, we were there on the cliff, and then you just threw us off, okay?
All you had to do was be patient, bro. That's all.
But you already mentioned her name. You said I'm not trying to put any pressure on you.
I wasn't there yet, man. Hey, man, somebody put him on mute.
I'm gonna lower his hand.
Thank you, Carol.
So to continue on with our theme for wellness this month, we have brought the lovely Kristen Millender. We brought the lovely Kristen Millender to come on the show to talk to us a little bit about oral health literacy in general, but we're going to definitely dial it down to oral health since she is approaching, or she is a senior now, right?
Yes, I am a senior. Yes, I am.
Yeah. Welcome to the show, Chris.
Thank you.
You know these guys very well.
What's going on, Chris?
You're comfortable? You know the shot?
Oh my God.
So, oral health literacy.
Mm-hmm.
How would you like to lead us on that?
Well, the first thing I want to do is actually ask you guys about some things that are probably myths that you guys may want to debunk, or if you heard anything about dentistry, or you had any experiences, or if you just like been reading things, because there's been a lot of stuff on the internet and social media. Some stuff is false, some stuff does have some truth to it. So I wanted to ask you guys, what are some things that you guys have heard that you kind of want to know? Is that really true, or you know what I'm saying?
So I really got to brush my teeth every day? Like, is that really true?
Is that a serious question? Really?
I think Art had a legit.
No, but some people
That's a valid question, though.
That is a valid question because some people don't brush their teeth every day. Honestly, yes, you should brush your teeth. We really like to say twice a day. At least once a day, but if not, then bacteria food will collect like on the bottom of your teeth along your gum line, and then you have like gingivitis and stuff like that. So yes, we do want you to brush at least twice a day, definitely at least once a day. But there are people who do skip out, believe it or not.
What about what about this whole apple a day keep the dentist away thing?
Yeah, so that's a myth, guys. And I think it goes an apple a day keeps a doctor away, but which dentists are doctors, but still, apples still break down the sugars. Doesn't matter. It's not like they're better sugars than like some like hard candies and stuff like that they're not sticky, but it's still, if you're not brushing and flossing, you will still have problems if you eat an apple versus if you eat a Jolly Rancher. You're still gonna have some issues.
Sugars, proteins, and carbohydrates again.
That's right. Stay away from them.
So as we continue on with that question about brushing, some of these myths that come along with the mouthwash brands that they last for 24 hours or 8 hours. Can you go in a little detail on how long the toothpaste and that 24-hour protection, is that true, or that just what they put on the labels that people can buy it?
Well, if there's anything put on a label, it has to go through some type of experimentation, some type of research in order to really say that, or it'll be misleading and false advertisement, right? So we want to believe that that's true. What I would suggest is that anything that has been trialed and has the support of the American Dental Association will have the ADA seal of approval on it. And you can really trust that, because that means that we've reviewed that literature and researched it, and it has shown the test like exactly what they're claiming. So I can't speak to every brand, because there are things that kind of, get through the cracks, and some things are sold. But if it has that ADA seal of approval, then you can kind of trust that.
Perfect. So I gave you a softball so you wouldn't get hurt. Now I'm going to throw you a hard one.
Right.
So is it true that just like with doctors and the HMO plans and dental plans, that some dentists prefer to just pull teeth, put in fillings without actually going through the process in poor neighborhoods versus those who have preventive maintenance in the more, affluent neighborhoods?
Oh, that was a Nolan Ryan fastball.
I haven't really heard about that. So, I mean, with dentistry, we've tried really hard to be preventative, especially when we're dealing with like children. If we pull teeth, that causes other issues. So in order for us to like be okay with pulling teeth, it has to be a really bad situation, some really bad infection going on that will compromise the adult tooth coming in. So pulling teeth, I mean, that's not something that dentists like to do. A lot of times we're kind of put in a situation where we kind of have to do that because, we have to do that because some people can't afford what it takes to kind of salvage a tooth. So if he has a tooth that needs a root canal, and on top of that, they're probably going to need a crown. Well, you will have to have a crown placed on your tooth after root canal, and that costs a lot of money. So some people are like, I don't have it. You have to, they elect to have the tooth extracted at that point. So it's not like, dentists are walking around like we'd rather pull. I mean, I think the common consensus among dentists are to be preventative. So as long as that person's coming in like they're supposed to get their routine, exam and cleanings and x-rays done, then, I mean, the chances for having to pull a tooth is, it's minimal. But a lot of times people come in because they have an emergency or, there's pain now because they waited so long. And that's kind of what they're left as their options.
Okay. I asked that question because everyone on this podcast knows that I fly to my dentist in a totally different state because of the experience.
I had no idea.
Yeah. I fly down to Miami, get my teeth cleaned, get my teeth, whatever need process is done. But as a kid in Philadelphia, I feel like they didn't care about the kids. They were just going there. Okay, you got a small cavity, just fill you in. Like, no, hey, do this, or no, you have a low fluoride, so you should focus on doing this kind of toothpaste. That wasn't told until I got all the way until college and saw this new dentist, and then I was like, wow, the things you get when you have a little bit more affluence or better insurance, you learn about how to prevent these things. So,
to speak to that also, dentistry has gotten a lot better with awareness. So we're really trying to push awareness, especially in the lower income communities, because normally our population, people who come, we don't have as many people for, of course, obvious reasons. Either they don't have the money, a lot of times dentistry is looked at as an elective healthcare, procedures, and not really like, no, this is really what, just like you go and you get your physical every year, you do need to go and get your cleaning exam at least twice a year. But we're trying to do a lot better with that awareness, which is great. Another great reason why you guys have me on a podcast, actually, because it's, I can get some information to some people. And then sometimes, patients will go to a dentist and will explain some things, but it's a little intimidating for someone who's not familiar with the jargon, right? So you hear these things and you really don't know what a lot of it means, which is another reason why we're going to talk about health literacy too, because we do have to find a way to really get through to people and help them practice preventative measures so that they don't have those problems, and so they don't go like you did, you went to the dentist, however, there was some information that you just didn't receive for whatever reason. We kind of really are trying to like stop that and really get to our patients and help with that.
I am proud of my teeth nowadays. My dentist in Miami has hooked me up and took care of me. So shout out to my dentist. I can't give
wonderful.
But yeah, he knows. Dr. Surge, we're good to go.
So about the fluoride content, I know that there are certain toothpaste that has higher content of fluoride in it, and I've just heard different things about it. Is fluoride something that we should be looking for in our toothpaste, or should we try to get a lower content in the toothpaste?
Well, after a certain age, fluoride matters, but you don't have to go like crazy with fluoride, right? So normally with children, we recommend that they're drinking like tap water, not so much always bottled water, so that they can get some of the fluoride there if they live in an area where the water is fluoridated. And that's another reason why, people need to come to the dentist for preventative care, because we'll also give fluoride at that time as well. But we don't need to give too much, because there are toxic levels of fluoride, just like there are toxic levels to anything. If you take too much of something, they say too much of anything, it's not that great. But fluoride is definitely good. And I would definitely use fluoridated toothpaste. There's nothing wrong with that. You don't want to just like overdo it.
Right.
but it's only gonna help. So if you're like in the beginning stages of like having a cavity or something, fluoride is good to reverse that process, help with reversing that process.
And I should have said enamel. I was thinking enamel, not fluoride. So low enamel as growing through a kid causes cavities in your teeth. I had that. My wife has teeth, strong teeth, and has never had a cavity in her entire life. And it's just depending on your what's the word, genealogy, you can have naturally low enamel. Yeah, some people have thinner enamel than others. Some people are really resistant to cavities. Some people also, their saliva combats the acid produced by bacteria better than some other people. So there's a lot of different facets to like combating that acid, secreted by bacteria that actually cause the caries. So a lot of people think, oh, it's sugar. Sugar causes cavities, but actually the sugar feeds the bacteria. The bacteria secretes the acid, and acid is what causes caries. So even you want to be careful with how much soft drinks soft drinks, sodas, all that kind of stuff. Yeah, you want to be careful with that. It's not just candy. Yeah, I wish you'd have met when I was in my younger age. But my dentist is good now. So no, it's good. My dentist is good now, and because of the education I've gotten, I can now educate others, and this is going to help people who don't think about those small things, how important it is. It is so important to be informed.
How much difference does it make when you're drinking, say, coffee, for example, through a straw as opposed to drinking it straight from the cup? Like, does that make a big difference as far as dental care, or is it still the same damage that can be done?
You actually drank coffee through a straw before, sir?
Yes.
Yeah. Duncan, doesn't say your teeth.
Because it doesn't. Does it not? Because the story is that it doesn't stain your teeth as much. Yeah. Like if you drink
coffee.
Yes.
Ice.
What the I don't drink it through a straw, and I don't jug it around in my mouth while I'm drinking.
There's no filter. You know what I mean? If you drink it through a straw, it goes straight back.
I got you, Jay.
The cup. It goes.
I think that's a valid.
It is, but when you're sipping though, a sipping motion is not like you're rinsing like you do with Listerine. When you sip, you're still minimizing the amount of coffee that's spread throughout your mouth. Think about sipping.
But it hitting your teeth first, right?
What I'm saying.
I don't sip through my teeth. I don't know how you're sipping.
Let's see. So I sip between my teeth.
Your first two teeth always get the sippy cup. It's where it goes first. That's why it's too cold. People go, my teeth's cold. It goes to the first two teeth.
It hits your teeth first. Yeah.
It hits your teeth first when you drink out of a cup as opposed to drinking out of a straw. So I'll just add, like, there's talk about it not staining your teeth as much if you drink through a straw as opposed to drinking straight from the cup. I just didn't know if that was truth or myth.
I don't know either. I mean, I would have to say I don't know of any like studies that have been done to kind of show that, but I guess the kind of common sense, like the less amount of area that you're covering with the juices or whatever you're drinking, then just the less contact and less probability that you'll have a cavity there. Right. But I don't think it's a huge deal if you sip versus drink out of a straw.
Hot coffee through a straw.
Yo, it is
I got two questions.
Okay, go ahead, Fresh.
First one, is there a way to find out, where do you go to find out if your water is fluoridated?
Fluoridated.
That entire statement should be edited and read. I love it.
Translation under the bottom.
Okay, so you can probably go to like the county website that you live in, the county that you live in, and just type in the search bar fluoridated water levels, and you should find something there. You may be also able to find something and information for anything that you probably have a concern about at the ADA website, and it's ada.org.
Awesome.
I have a question with that one. What is an appropriate level? So, like, if you look, like, what should you be alarmed and pissed off at, and what should you be like, all right, I'm good?
Well, I believe that we cap it off at 0.7 ppm, which is parts per million. So you want to look and see that you're at, at least 0.7, nothing really higher. But for an adult,
move.
I'm sorry?
If it says Flint, Michigan, move.
Yeah, if it says,
it's getting better over there in Flint. I have a couple. It's getting better.
What were you saying, Chris? For an adult?
For an adult, I mean, the amount of fluoride you get in your water. I mean, you're an adult, so I mean, our teeth, the fluoride that we get, it takes effect way before like our teeth come in. So even babies, like the fluoride that they get before their big teeth emerge, that fluoride is already being incorporated into their system because they have baby bud teeth. All right, so that's already being incorporated even before you actually see them erupt. So, but when you're older, I mean,
it's almost too
fluoride in your toothpaste, you know what I'm saying? Sorry.
So the need for it decreases as we get older. Is that what you're saying, or is it just?
No, it does decrease.
Okay.
I mean, it's not as effective.
Okay.
Yeah.
Yes. Oh yeah, you got a second question. Go ahead, Fresh.
Part 2 was about sensitivity. I suffer from extremely sensitive teeth. Is there anything past Sensodyne or any other recommendations that you had?
I actually went to a dentist and they told me to stop using Sensodyne.
Well, this is going to be amazing.
Yeah.
So depending on where a dentist is trained, they get different information. So at my school, we actually give out Sensodyne packages and samples. So it definitely helps. The thing with Sensodyne is people don't like the way it tastes and people don't like the way it feels because it's kind of like
grainy.
Yeah, it's kind of soft. It feels weird. It doesn't feel like, the toothpaste that we're actually used to. But that does definitely supposed to help with the sensitivity. I don't know of any other, I'm sure that there are other like Crest or some other big name brands. They have like, certain lines for sensitive teeth, but Sensodyne is like the biggest name.
Fair enough.
I love that brand. Used it. It's great. It does help sensitivity.
I thought it was great too.
Brett, now a question I have, Chris, is for you, and Brett, you probably can sign on this as well. Whitening whitening toothpaste. My dentist said, "Hey, don't use it too much because it starts to strip away, like at your teeth. It's not really good to use all the time." Is that a true statement, or is that something that because whitening's everywhere now? Everyone's using it, but it starts to pull away at your actual enamel because it's breaking it. Is that true or false?
Mm-hmm. Yeah, so it can make your enamel a little more porous because what is it doing is getting into the teeth and kind of extracting those stains. But normally what we do is if you have sensitivity already, we just decrease the amount of hydrogen peroxide that's in it. So you just get a lesser, amount, a lesser percentage, and you should be fine. But you also want to be careful that when you're brushing, watch your brushing technique, because if you're brushing like this, I wish I had a toothbrush with me. If you're just brushing like this, you're kind of abrading your gums. You know what I'm saying? Whereas we brush against the gum line and kind of like push up. I'm sorry, I don't have like something to really show. You're like moving the food away from the gum line, so it's,
so should it be like the circular motion?
Circular is good. And also just a sweeping motion away from the gum line. Yes, but never like this, guys.
Okay.
Straight for the people who's listening, that's straight across. For people
no left to right, more
straight across,
down, front,
down, or up,
right,
sweep to the front.
Yes, and there are tons of videos on YouTube that you can look at. And again, 88.org is a great source. But you can see the brushing techniques if you need a visual.
Nice. So sticking with the brushing of the teeth, I have one question, and we're going to get into some more of this oral health literacy, which I feel like we covered a lot of it just in this last 15 minutes.
Mm-hmm.
But with your children, so my son, you're brushing his teeth, they give you the early toothpaste or whatnot that doesn't really do anything as far as I'm concerned, because I brush his teeth, and even with the bubblegum smell on the toothpaste, his breath still stinks. So is the children's toothpaste worth using on your son or daughter, your child, even when they get of age? Like, he's 5 now, so he's not going to swallow the toothpaste at this point. So I should go ahead and switch it over to the adult toothpaste?
No, not yet. I was with a child toothpaste. One thing that is kind of like a myth is that bad breath always comes from the mouth, right? But that's not the case. Sometimes bad breath is just from their stomach and the gases that is being excreted in the stomach from the food that they're eating. So you can use, like, toothpaste is not always going to combat bad breath, basically, is what I'm saying. I would not move on to an adult toothpaste with a child unless their pediatric dentist says it's okay. I would listen to that.
Nice.
Because there's other things in toothpaste. Like some toothpaste has, alcohol content. You kind of want to be careful, Stick with the children's toothpaste.
Makes sense.
Feels good to have a dentist in the house.
Yeah, I didn't even know. I didn't know food like the bad breath smell can come from your stomach. That's so it transitions into what that child is eating then at that point.
I mean, yeah, you ever eat something that gave you gas and you burp and you're like, oh, that's disgusting.
Right.
Well, I mean, yeah.
It is.
So moving on into some of this oral health literacy, what do you find that are some of the common challenges amongst our community when it comes to oral health literacy?
Well, first of all, I want to ask you guys a question. What percentage of Black people do you think actually go to the dentist?
20.
58.
35.
Shoot. Can we narrow it down by like income levels?
No, we can't.
Throw a number out there, man.
Actually, I say more like 37.
Or maybe I shouldn't say actually go to the dentist, but actually get dental treatment, dental care.
I say 37%. I think it's low.
25.
Fresh is that personal price is right. I said 35, bro.
36.
y'all staying around 30 something. It's actually 55%.
I was right at first. I should have stayed with
you were really, really close. So, and that was in 2006. So I would hope the number increased, but approximately 55% of African Americans visited the dentist that year. And so it's still a lower number. We would like to have higher numbers for our white and Asian counterparts. It was more like 70%. So, we're still lagging behind, but it's not as bad as we probably would assume it to be. Yes.
With that 55%, that statistic, is it quote unquote inflated in any way, shape, or form, or is it like a true 55? Is it a representative number of us, I should say?
Well, according to the study and how significant the statistics were, we can trust that.
Okay, because I know I hear a lot, we have a lot of our community may get this healthcare from the military.
Yes.
Or when you're incarcerated, you have to go to the dentist. Mm-hmm. So if those are creating a larger source of this 55% in the actual community, it might be somewhere around these 30s.
In the community, it may be lower, but that number looks at, population, all Black people in the country. And they took a sample of Black people, right? So they didn't look at every Black person in the country, but from the sample of Black people, they found 55%.
Okay, and what do you think contributes to the lack of, sort of outside of the obvious, we obviously know the issues within our community, but what are some things that you see prevalent?
A big one is fear of dentists. So a lot of my patients, they love me because I have kind of mitigated that fear factor for them. I talk them through things starting from the first appointment when I'm just getting to know them, and I acknowledge that, they have this fear, and I let them know that it's okay. It comes with a lot of anxiety. A huge part of dentistry is just the behavioral aspect. And, they could have been traumatized previously when they were younger. All that really matters. Also, I'm going to show you guys here. Let's see. All right, media. So how do I move that? Okay, so you guys see the dentist. This is scary, right? I don't even know what those are that's coming out of their gums. That's crazy.
Disgusting.
Right? That's crazy. Sure. Dr. Giggles, that's crazy. All of this incites some type of fear. Little Shop of Horror, you guys remember that movie? That was, the dentist in that movie was really bad. I think he was beating up on that girl. He just sucked, and so it's from a very young age, you're already getting brainwashed by media and Hollywood that dentistry is bad. And not just that, but one of my patients told me she believes that she's so scared of the needle because when we go to numb, you see this syringe that's this big, right? It's a long silver syringe. The needle is that small, you know what I'm saying? And it's really small, it's tiny. So the way that our patients are perceiving us and perceiving the instruments that we use, perceive the profession, then you have the distress, they're charging a lot of money. Does this really cost all this amount of money? Blah, 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 blah. You're trying to pay your student loans. And then if you look at, the fact that, okay, in this country, medicine hasn't been that kind to African Americans. That's just the truth. There are things that have gone on. We've all heard of the syphilis incidents and there's numerous research studies that have happened that kind of abuse African Americans. And so we've been taught not to trust dentists. And I honestly feel it's not really until we start really making up some of these numbers as dentists that trust, will really improve. So,
how do you see the efforts within our community? I think Maryland does a great job with getting you guys in the community in Baltimore with, I think it's SNDA, and then you guys have another program that you do every year.
Yeah, we do mission projects for people who can't afford dental care, dental work. We do all of that. So, I mean, we're really trying right now with our current administration not to get political. There's been some budget cuts. So the amount of outreach will probably be affected for at least the rest of this administration. But nonetheless, we are still like in high schools, in middle schools, at these mission projects, really trying to get involved and really trying to increase that awareness.
So with the people with low health literacy that are affected, what efforts, what do you see as the detriments within, like their social detriments? Where you see coming from our community as far as that?
Well, first of all, finances is a big thing. Some people elect not to have dental insurance. They'll have their medical insurance, but again, dentistry is looked at as like an elective procedure until something hurts. So, an elective healthcare area until something hurts. So finances play a huge role. We already talked about the fear. What else? Sometimes our people of color perceive discrimination. I'm not saying that it doesn't exist, but, and that can be something like an example is like having to wait in a lobby. They may feel like they're being discriminated against. They have to wait longer. Why? It's because I'm Black, blah, 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 blah. And that might not really be the case, but because we already have that mistrust, it's already there. Another big thing is access. So if we have like big cities, in more impoverished areas, you're probably not going to really see a dental office. Some of us are courageous enough to, or just have enough integrity to kind of go back and give back to our communities and set up shop. But those are not really, honestly, desirable areas to kind of set up shop and live in, especially if you don't know if it's going to be that lucrative. So you got to really want to have a passion to kind of give back to those communities to really kind of set up there. So access is a huge thing, right up there with our finances, actually.
I want to talk a little bit about the importance of oral health because I think a lot of people are misinformed to how much it plays into other diseases or other illnesses that you can have if you don't take care of what's in your mouth.
Mm-hmm. Yeah. So periodontal disease, which is like beyond, gingivitis, basic gum disease.
What does that even mean, first of all?
So periodontal disease is a disease of the gum tissue and the ligaments that hold the tooth in the socket and the bones surrounding the tooth. Those are periodontal disease.
Don't tell me.
Oh, okay.
I'm here.
We have ligaments in our teeth. Hold on, let's back up. Let's talk about it.
Sorry, I don't mean to push you out.
So periodontal disease.
Periodontal disease. Yeah. What was your question, Fresh?
The teeth ligaments. We got teeth ligaments.
Yeah, we do. They actually act as shock absorbers.
Like when we're eating food and stuff like that.
Mm-hmm. When you're eating, when you're chewing. Yeah, it's pretty. There's a lot of biomechanics that go into your teeth. But they act as shock absorbers. Say that again.
I thought the tooth just sat in the hole and we were good to go. Jump off ligaments and teeth.
No, you gotta have a ligament there to protect and be a cushion and all that other stuff.
Learn something new every day.
You do. It's pretty interesting.
17.
Pretty interesting, right?
Yeah, definitely. I'm sorry. Continue with the period. I'm not gonna try to say it.
I forgot the question. What were you asking me?
Periodontal disease, how that impacts.
Oh, right. Yeah. So, in dentistry, we know that periodontal disease actually has a correlation with diabetes, with cardiovascular diseases. And so there have actually been people who suffer from like cardiovascular disease, like heart attacks and stuff like that. And if you look at the plaque that's sitting in their arteries and you extract some of the bacteria there, well, they find a lot of periodontal pathogens in there. And so you can see like, when you have gum disease, when you have periodontal disease, that bacteria can get into leaky vessels and travel through major arteries and form plaques. So there's definitely a relationship. I don't think we're at a point where we can say, we can't say one causes the other. We can't say periodontal disease causes, heart disease, but there definitely exists a relationship. And there may be something where periodontal disease actually exacerbates heart disease.
Right. Wow. And that's caused from like the the soft drinks that you mentioned earlier and the foods that we're eating, that's what causes the periodontal the disease.
Well, what causes periodontal disease is bacteria that produces plaque.
Okay.
So that plaque is sitting on your gum line, all right? And it can get under your gums and it causes inflammation. And that inflammation causes your bone to react and kind of pull away, and then your gum tissue will pull away. And that's why you start to get recession. So it's not necessarily the sugar. The sugars cause the cavities. The plaque, can cause periodontal disease.
Okay.
Mm-hmm.
Wow.
So going to continue on with the health literacy, I think one of the biggest things, you might have touched on it a little bit earlier in the podcast, that kind of impacts that. But one of the biggest things might be the lack of African-American providers that there are in our community. So how do we kind of impact that? I mean, what do you see as far as trends are going with the African-American population within dental school?
So it's a couple of things. When I first came into dental school, I had a class called evidence-based science, evidence-based dentistry. And one of the things my professor talked about was they did a survey for graduating seniors, and they asked a question about what made you interested in dentistry? And the top answer was, I knew someone who was a dentist. So right now, active dentists, Black dentists, make up 3.4% of all dentists. Not a lot of us at all, 3.4%.
How many of them are females?
I don't know how many are females. I don't want to guess. I don't know. But just to give you guys an idea, I want to show a quick graph because it's different when you actually see.
Facts.
Yeah, 3.4%. Wow.
That's crazy. Is that because of the cost of dental school?
Possibly, but yeah. Hold on a second. It could be because of the cost. How do I?
You always hear, parents and talk about you got to be a doctor, you got to be a lawyer, you got to be an engineer. But people still don't categorize the importance of dentistry in the doctor category. That's still health,
right. And
it gets lost in the shuffle, and that's just crazy.
Off. Yeah, give me a second. I'm sorry. I'm just trying to pull this up, and it looks like. Can you guys see that?
We can. We see that.
We see the dental myths. Yeah, we see your screen.
Yeah.
Okay. All right. So here you can see. This is in 2006, so the numbers may have increased a little bit, but you can see our white counterparts make up 86.2% of active dentists, whereas African American Hispanics, we make up 3.4% each. Asians are 6.9%. Okay, so you can see we have a very small piece of the pie. This graph here will show you the general population. So these are the people who actually work. And then, no, this is something else. Let's look here. So as you can see, Black people also make up, the least when it comes to faculty in dental schools. And then here are dental students. So, we have very low numbers. And here go practicing dentists right here. So throughout all of these, we have very, very low numbers. And then here is this is the last one here, but it just shows how many, these are applicants that are minorities. And we had some increase between 2003 and 2006, but as you can see, we're still all the way down here. We have Asians here and white Americans probably be either at this level or, somewhat above. But we have a lot of work to do. We have to get more Black people involved in wanting to practice dentistry. Yeah, let me close this.
So what can we do? What is the most interesting thing you would say about dentistry, so we can try to start pulling, our Black people into this field, this growing field?
What's the most interesting thing about dentistry?
Yeah.
I think it's kind of subjective. People like different things, but for me, the most interesting thing about dentistry is actually being able, if you're a science person and you like the idea of understanding disease process and still being very hands-on, like every day I'm able to be hands-on, so that's very interesting. Meeting people, understanding, anxiety, and, sometimes I feel like a psychologist almost. I'm not a psychologist, but sometimes I feel like that because, people who come to the dentist actually visit the dentist more often than they actually visit their doctor, because you go once a year unless you have other things going on, right, to see your doctor. But with dentistry, you're supposed to go at least twice a year. And if you have something going on, then you go a lot more frequently than that. So you wind up building a really good relationship with people and understanding them. And then you're able to really like, you know, when people have issues with their smile, it really affects their self-esteem. And this goes so far. I mean, even when they go on interviews, like if you look at some people who don't like their smile, or their teeth, they'll modify their smile. You know, a lot of times they'll like that, or like you just see maybe the bottom part of their teeth, or like they learn to not show their teeth. And it does have an effect on them. So like if you're able to give back and improve that for people, you feel grand. You know what I'm saying? Like I gave someone that, and they can take that and go on for the rest of their lives. And it really improves their quality of life. I mean, it's a wonderful thing. And then I get fixated on a lot of things. So I just like taking care of stuff that like little things like cavities and stuff like that. And the instruments are amazing. The dental the drills that we use, the burrs that we use, everything's very intricate and very technical. There's a digital aspect of dentistry now where we're scanning, you know, gum lines and margins and all that other stuff. And we're actually making crowns in office. You know, it's just, it's very rewarding, very fulfilling, but very, very sophisticated. So to be a part of that profession, I think is just amazing.
How are we? I'm sorry. Go ahead, Jay.
No, I was gonna say she made it sound like the dentist is like your best friend. I need to go.
I feel like my dentist is holding up to his position, right?
Yeah. My dentist is that person. My entire dental office, we're like family. I go in there, they know my kids' names. I've been with them for years.
Yeah.
I mean, granted, I'm coming from another state, so I can call in and say, "Hey, I'll be there on this day. Make space for me." They go, "Yeah, no problem, Art. We got you. You're good to go." But that took time to build, and it's been great. And yes, my dentist is also had the curves. He's been doing. He has a TV on the ceiling. He has digital. Instead of doing X-ray with the actual X-ray, it's like digital now. Crowns being made inside the temporary. Everything being done there. And just seeing the abilities or painless, drill, so it's not like as loud or it's just water. So those things make a difference when you're going to the old school dentist that like still has that hardcore drill that changes ahead of the curve. Also helps you grow confidence in your clients. Yeah,
I mean it goes that patient provider relationship goes so far, and I mean and to be able to trust someone to go into like an area of your body that you barely can actually see what's going on, is big. And I would like to believe that most of us, take pride in that and respect it and do the right thing by it.
I got a follow-up question. And I don't know if I'm assuming you're about to wrap up, B, but with dentistry being so minimal amongst the African-American community, what made you, just like with that not being a common profession that we go into, what made you decide to even consider that as a profession and consistently pursue it after all of these years?
Well, for one of the reasons that you just stated, we're represented minimally in it. So I look at that as an opportunity, right, to give to that profession. So it's for me, and I'm not saying this is for every Black person, everyone's different, but for me, it's important for us to find ourselves in places that we're not in, that we're lacking. So if I wasn't so interested in science, I probably would have went and been a lawyer and became a judge. I tend to look into areas where there's a need for us and a need for us to be protected in. And so that coupled with the fact that I kind of got to be an example, like these kids, I do a lot of mentorship in Baltimore, in the city, and they have to see us. They have to see people that look like them to know that, hey, I can do it. I can do this too. And then like even being Brett's here, but technically I'm a single mother. And even with that, for people to say, oh, she had a child and she did this, and it wasn't easy, but it's something that I wanted. It's something that I wanted for myself and for my community. And so I did it,
That's
challenges or whatever. So
that's amazing.
It's really important to me.
Well, thank you, Chris, for coming in and gorillaing the mic and dropping all that good information. You can go ahead and take the podcast wherever you Wait, man, since you know, up there front and center, it's your show. What do you want to talk about next? Don't be nervous.
You didn't have to do all that, but I do want to say one thing. Okay, I do want to say one thing. I didn't know like that I wanted to be a dentist until I went to college. You know, like some people say, oh, when I was little, I got braces and it changed my life, blah, 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 blah. I didn't. I've always had straight teeth. People always complimented me on my smile and always asked, did you have ortho? And I say, no, I never had braces. And they're like, wow, how did that happen? But then I have a sister who, you know, her teeth were crooked. And I saw the way she smiled and I saw how it affected her self-esteem. And that was one thing that settled in me because it's almost like survivor's guilt or whatever it's called. You know, it's like, oh, I have this and I have a more effective interaction with people. And someone who I love very closely to me does not have this. And I see what it does to her. And so that coupled with the love for science, blah, blah, blah. But then when I went to college, I didn't think about it. I thought that I was going to go into social work or something. I actually didn't really give it much thought. I was just happy to be in college because I didn't even think that I was going to go to college. Honestly, at that time, it's just my high school people went to college. That was the only reason why I even pursued it. And my dad came with me, and there was like a program fair where you go and you get to look at all the programs that this school offers. And like I said, I thought we was going to stick around, you know, the easier stuff. And my dad is the one who walked me to a pharmacy table. And at that time, I'm like 17, and I'm just like, oh, I never thought that I never even thought about pharmacy or anything medically related. And, but I knew that I didn't want to do pharmacy because that's just boring to me. No offense to any of the pharmacists out there. I'm just not with it. So, although there's a lot of pharmacology included in dentistry, but it got my mind going like, oh, I can do that. Like this is possible, you know, like it just exposed me a little bit, you know, and my reasons for staying a dentist have changed over the years. But what I'm trying to say is like, it's really important for us to like, you don't have to be like raw, you have to be a doctor, but it's just really important for us to expose our children, even if it's just walking them to a table and letting them like see it for themselves and kind of initiate that curiosity, because that's all it took. I already had everything else, you know, it's just that I needed someone to say, hey, this is an option. And I was like, oh, it is an option. And then I decided to do it, which is another story, but yeah, I just want to say that.
So that's awesome, man. I always have you know, weird things to say randomly, but yeah. So it's important that your dentist, your physical trainer, your doctor, people you're working with have the attributes you're looking to get. And if someone's a dentist and they don't have, you know, great teeth or great breath, it kind of makes it harder to believe in their practice.
How could you? I couldn't even go to a dentist with bad teeth.
Hey, there are stylists who will do hair and they don't have their hair done.
That's true.
No, sometimes people put themselves last.
This is true.
But you got to be your own brand advertisement. Mm-hmm.
Is it true that all dentists hate J. Cole because he put out a song like Crooked Smile and dentists, you know, visits dropped by 17%? From what I'm being told, after Crooked Smile came out, because there was more of an acceptance of them.
No, actually, I don't think so. Wait. Do you guys think that gaps are issues?
Nope.
I think teeth are just like weight, right? It's more about the person and how they reflected themselves. It's more a personal thing and how you're willing to accept it. Just like I'm sure you were saying with your sister, where there are people with gaps who look beautiful because they are not subconscious about their gaps. There are people with crooked teeth who are not, you know, you still consider them having a beautiful smile, but it's because they're not self-conscious about it. So
right.
It really more so depends on the person and how they reflect themselves to other people that determines how accepting, I guess, it is.
Right. Well, the difference with that is that people with crooked teeth and what we call malocclusion in dentistry, that that can cause real issues. But a gap or a diastema, what we call in dentistry, there's nothing wrong with it. It's fine. So we really don't try to push braces because someone has a diastema. I think it's a myth that people think that something's wrong, but it's not wrong. It's just that person's anatomical makeup. That's it. And
how do you feel about Invisalign?
How do I feel about Invisalign? I mean, it works for basic level cases. And if your doctor feels comfortable with doing it, it's faster, and
but what you mean? I saw the commercial. I can go ahead and just hit up the number like they sending them bad boys out like contacts now.
I would definitely. Well, that's the same thing with like bleaching. You can go get a bleaching in a mall, that type of stuff. I would always encourage people to have this stuff done by a dentist, because if something goes wrong, trust me, I believe that if you're going to get a bleaching in the mall, or if you're getting Invisalign trays in the mail, that Invisalign trays in the mail probably are not an issue. But read the information that you're agreeing to, because especially with like places in the mall and stuff like that where there's no dentist really supervising things, something goes wrong and you signed your rights away and your gums are falling off.
That's another big part of that literacy portion, right?
Yeah, informed consent is big with literacy. You have to really know what you're getting yourself into and make sure that you're protected. It's always better to have a dentist who is an oral health specialist involved in that process. Always better.
Makes sense.
Awesome. Well, this is great. I love this topic.
I love that you love this topic.
I love
I want you to ask more questions.
Yeah, that's my thing.
The piece. It just seemed like that was a game changer for you, and I think it'll be a game changer for the rest of our community. Just exposure, just letting people know about it. This right here in itself will be a game changing nugget. So
I hope so, and I do have to put that disclaimer out that I'm not a dentist yet. I'm a senior dental student. So, if you want, you can go back again, ada.org is a great website to reference and to learn more information. Just be careful what you're getting, where you're getting information from. You Google things, just be careful.
You can't use celery as dental floss, y'all.
Ew. Celery doesn't even taste good. Why would you?
It works, all right?
Anything you can use a stick in there and get to it.
Right. Don't use a paper clip. Don't.
Paper clip?
Hey, they got gaps.
Don't use super glue.
What about putting the foil on your teeth? Y'all ever did that when y'all was kids?
Like the gum. I can't do it now. The foil.
The paper clip.
Why?
Because you want to shine like what?
Whatever you want to be like Nelly.
For
the front.
Like aluminum foil?
Absolutely.
Yeah, like the gum from the gum.
Yep.
100%.
No, I'm talking about like the Reynolds wrap, bro.
Yeah, get your drill on.
I never heard of that before. That must be a Petersburg thing.
Let's go.
Shut that down real quick.
I never heard of that. You haven't heard of it either.
I think actually every fella in here.
I'm about to say I got
reeled up.
Pretty much guarantee every dude on this podcast has done it once.
And I'm taking the Reese's to black out my teeth.
My God.
Reese's cup paper. Black out my tooth and make it look like I don't have a tooth.
Oh my God, that's
I know
crazy.
I'm not the only one.
Exactly.
That's crazy.
Hey man, we gotta go ahead and start wrapping this thing on up, man. Faison, why you going on mute, bro? It's your turn.
I'm respecting. I didn't want to take away from the screen. That's all. Just trying to make sure that.
Man, it's Corner Day Faison time, man. What's happening in Arts Corner today?
So
this evening,
this is something that I kind of fell upon about networking. So the corner today is just network where you don't think networking isn't important. An example is my neighbor. We all talked about last week's podcast about real estate. So I've been trying to get in real estate for a little bit, reading books, so forth. My neighbor 2 doors down actually flips houses for a regular basis. Did not know that until one day we were outside with our kids just talking about, hey, what do you do? And he said, I flip houses. And I do it in Baltimore. I do it in Maryland. I do it in Philadelphia. And I'm just like, this is crazy because you don't know who's around you. So it's hard to go in and do it as a professional. Hi, my name is so-and-so. What do you do? But casual conversation in weird places could wind up being a network opportunity for you. So network in places you don't think networking is important by just being yourself and open.
Easy, man. Before we get to Fresh and Biz, hey, did you get a new broom this week? Because I told you that boy was going to get swept. I had to do it, man. I had to do it.
I've been talking about it the whole time.
He told me the Celtics was going to sweep too.
Hey, man, you know what I'm saying? I just predicted it a little too early. Fresh and Biz, what we got this week, sir?
Well, first off, with Art's statement, you know, that's what we call in sales ABC. Always be closing. You never know when the opportunity is coming up. So if you are on your biz, be about your biz and make sure your biz is always open. This week, though, for Fresh in the Biz, we are going to talk about making a business plan. Plan your business. Put it on paper. Write it out. Have, levels to this thing and understand what you are getting yourself into. But more importantly, understand where you want and plan to go. Most people have their genius ideal, but they don't want to put it in an area that then can be critiqued, set up, and dissected by peers and other people who also do or have done the business that you are looking to execute. So with that being said, make sure when you create your business, you create a business plan, think it out different ways, get other people to come and help you and talk about it, and don't try to make it such a secret. Get the word out, make it a plan, make it a successful plan your business. Fresh and Biz this week. We out, let's go.
Easy. Hey, J-Dax, do you have anything you want to add before I go ahead and wrap us up?
Oh, yeah, man. If we're trying to lose, me as a health and wellness enthusiast, man, trying to very, very much so push weight loss. Being overweight is not fun. So just a quick tip that you could do: lift more weights. Muscle is our fat burner. It's like the biggest fat burner that you have. So lift more weight. I would say like 3 times a week if you could lift weights. You're really doing a significant change in your physical health. So lift more weights if you're really trying to lose that weight.
And don't be.
What if I don't want to lose weight? What if I just want to make?
We are not trainers. We are not doctors.
But it's a few athletes on here. Don't be in the gym doing this old crazy, gym routines that are
really don't even, and you don't even have to your body is a weight. So you could sit ups, you could do pull ups, regular curls. You could use your body or you could use actual weights. You don't have to do anything too crazy, but just that simple shift. It's a real game changer, guys. So it increases your basal metabolic rate, which is your resting metabolic rate, which is what that's what burns calories while you're sitting there doing nothing. Mm-hmm. So the more muscle you have on your body, the higher that is increased, and the higher that's increased, you can just sit there and actually burn calories. I think my calorie counter, I'm burning like 1,700 calories doing nothing. So definitely lift more weights and get more muscle on your body, and it'll fight against the fat that you have or that you're holding on your body.
And if you're not doing nothing, you're doing something. You're burning calories, dog.
The healthiest things: push-ups, squats. Those are 3 natural things you can do with your body weight that always help and are great things for your natural body. So if you don't have weights in the house, get on the floor.
Oh, you got weights. Your body is
sitting on them right now.
Everything in the house is a weight.
I'm gonna be cock diesel in about 2 weeks.
You gonna be working out? You gonna be working out with LeBron, Mike?
Nah, he don't work out, man.
It's all natural. That's right.
You don't have no muscles.
Hey.
Chris, we appreciate you visiting us on the 13th floor. This is one of our biggest supporters, man. You came in, dropped a lot of knowledge, did a lot of work, pushed me all the way out the camera and everything. It was a great show, though. It was a great show. Make sure you subscribe to the podcast. Get connected with us. All social media platforms at 13th Floor, please. You can catch the podcast on SoundCloud. You can get the videos on YouTube. You can catch the podcast on iTunes, Google Play, Vimeo. I'm not leaving you out ever. Yo, I can't do that. Oh, I cannot do that. I am not an alien.
I don't know how to do it.
Anyway, we up out of here. This is the 13th Floor, where the furniture isn't always the best, but the views
are amazing.
That's right.
The 13th floor.
Mike was quiet this whole time.
The 13th floor.